Welcome back to the Hand to Shoulder Solution, giving pain the middle finger. I'm Carl Petito, occupational therapist and board certified hand therapist. Let's talk about golfer's elbow. There's a nickname for everything in orthopedics. What is golfer's elbow? Why do I have it? I don't play golf. If you are having pain on the inside part of your elbow, there's a couple of things that can be going on, but let's talk about golfer's elbow. So it's the opposite of tennis elbow because it's on the opposite side. So tennis elbow is on the thumb side or the outside part of your elbow, and golfer's elbow is on the inside part of your elbow. So if you start on the top with your palm up, if you start on the top of your elbow area and come down to the side on the inside part of your elbow and touch here where there's a round bony knob right there, that's actually the end of the humerus. So this humerus or upper arm bone comes down and flares out. The inside flare right there is what you're touching right there. And that's the anchor point for all of the muscles that do this, grip, and turn it palm down. So if you squeeze something real hard and that hurts on the inside part of your elbow, or if you lift something with your palm up and that hurts on the inside part of your elbow, or if you touch that part and it's tender, most likely you have golfer's elbow or medial for inside part. The other side is lateral. So medial epicondylitis. It's that epicondyle or bony knob area. Itis means inflammation. So if that's inflamed, you might be leaning on the inside part of your elbow. And if you are, chances are you're also having numbness and tingling on the small finger side of your hand, which is cubital tunnel syndrome, which we talked about. The ulnar nerve is being compressed. We talked about that in another show. So focusing on medial epicondylitis or golfer's elbow, what you don't want to do is wear a thick compressive sleeve, neoprene sleeve. I've seen people come into the office wearing these. Sometimes I've seen them prescribed before, but they put pressure on the cubital tunnel. They put pressure on the nerve. They put pressure on the bony prominences and aggravate those because when you're moving, it slides a little bit. I've seen the skin get really chafed, but here's the mechanics real quick. So all the muscles in the palmar surface or the palm surface of the forearm are the muscles that they connect right here. So this is the anchor point. So when you bend your wrist and you grab something and you pick something up heavy, that's the anchor point right there. So there's one thing that we do use in the clinic for certain cases, is a counterforce strap. So a strap that goes around the meaty muscle part to hold it. So now when you do use those muscles, it pulls more from here and not so much the original anchor point on the epicondyle, and that allows that area to rest. Now, sticking the inside part of the elbow under cold running water only until it's deeply cold, 10 to 20 seconds, that reduces the inflammation very, very nicely. Now, the muscles in here tend to get very, very tight. The tighter they get, that means they're getting shorter, right? So if they're getting shorter, that means it's pulling harder on the tendon that connects the muscles to the bone and is aggravating the bone. If you lengthen the muscle, now you have less pulling right here. So proper stretches, if a person goes like this, palm up, and then pushes the hand and fingers down until they feel a good, firm, but not painful stretch in the forearm, that is really, really good for that and will be a great step in the right direction to get this to fully go away. So in combination of wearing that counterforce strap when working, when doing heavy things to help support this area, and then when relaxing, not doing much, take the strap off, do some nice stretches 3 or 4 times a day, hold the stretch for 20 seconds, couple of repetitions, nothing crazy. You don't want to be really, really intense with this stuff. Nice, gentle, sustained stretch, 20 seconds, 2 times, and then repeat that 3 or 4 times a day. After heavy use, let's say, a person's been working all day, at every break, I usually tell people to just stick under cold running water, just the inside part of the elbow, and then the muscles around the forearm, a low electric heating pad on the lowest setting for 10 to 15 minutes. Now, people ask me, I have the beanbag thing that I can just microwave. I don't like those. The reason I don't like those is number one, Every microwave is different. Sometimes they start too hot. It causes an inflammatory response, makes inflammation go way up. No matter what the temperature it is, they start to cool down immediately. So you want an electric heating pad with a thermostat so it stays on a nice low to medium steady temperature for a period of 10 to 15 minutes, 2 to 3 times a day, not more than 3 times a day. You can overdose on heat. It always feels great when it's on. But if more than 3 times a day, you're going to start causing inflammation. You're going to start really getting addicted to the heat. And you're going to say, oh, would have felt great when it was on. I'm going to go back to it and you stay in the heat. Then you come out and now it's inflamed and now it hurts worse. I'll just go back to the heat. It's a loop you don't want to get into. So 2 to 3 times a day. When people underestimate it, oh, it's just a heating pad. No, you can overdose on this stuff and really make things worse. So that's the basic mechanics. We want to stay protected during the day. You want to try to avoid a really hard, tight grip. You want to avoid lifting really heavy things palm up. If you can't lift palm up, my goodness, well, how can I lift? Hammer position. So if you can lift something this way, you're using some different muscles. You're still using some of the same muscles, but you're offloading those significantly. So that's a better way to do it. In the clinic, if you do these things, if you touch the inside part of your elbow and that hurts a lot and the muscles are touch the muscles and they're a little sore and you do a stretch and yeah, you know what? I feel a stretch. Just start doing some stretches right now. Stretches aren't going to hurt you unless you're responding adversely, then obviously stop. But if it doesn't go away in a few weeks, get into the clinic. You got to be seen. We have to do a thorough exam and nip it in the bud. It's not a lot of therapy. I have people come in, after the first visit, show them exactly what to do at home. I'll do some cold laser treatment or some other manual therapy techniques that the person can't do for themselves at home. Have them come back in a week, change up what they do at home a little bit, upgrade the home program, send them on their way, have them come back in 2 weeks. I usually follow up with them once every couple of weeks, week and a half to 2 weeks, with the instruction that if they have any questions or to call anytime, and with the instruction that if, goodness forbid, anything gets worse, they have to call, tell them I said I'd squeeze them in and get them right back in immediately if something adversely is going on. So anyway, the bottom line is it's not a lot of going into the clinic, but try that at home. Most likely it's going to make you feel better. But don't wear a tight compressive sleeve or anything that's putting pressure on the inside part of the elbow, right? Or anywhere on any bony prominence or any nerve. If any of your fingers are going to sleep, just stop using the device. It's just making things worse. Okay. Thanks a lot for watching. And thank you for subscribing to the channel. Thank you for sharing it with people who are having problems. This is meant to be a good resource to empower people just to simply feel better. Thank you.